Living Life with Pancreatic Cancer. Hello, this evidence-based content is prepared by Sabor Khan, fellowship-trained consultant surgeon. And if you or someone you care about has just received a serious diagnosis like advanced cancer, you're probably wondering what happens next. I know when you hear the words palliative care, it might sound like giving up. But today we're going to completely change that understanding. By the end of this video, you'll understand why starting palliative care diagnoses alongside your cancer treatment actually helps people live longer, feel better, and spend less time in the hospital. Palliative care is an interdisciplinary specialty focused on preventing and relieving suffering while supporting the best possible quality of life for patients and their families facing serious illness. Clinicians specialty trained in palliative care provide in-depth pain and symptom management communication about your goals of care and coordinated care across different settings and over time. Here's the crucial part. Most people don't realize. Palliative care aims to relieve suffering at all stages of disease and can be provided at the same time as curative or life-prolonging treatments. The single most important thing you need to understand is this: palliative care is not the same as hospice or end-of-life care. This misconception keeps countless patients from getting help they desperately need. Palliative care starts from diagnosis and works alongside your cancer treatment, chemotherapy, radiation surgery, all of it. You can receive curative treatment while also getting expert symptom management and emotional support. If you're supporting someone through this, I want you to hear this clearly. Asking about palliative care doesn't mean you've given up hope. When initiated early in the disease course, palliative care has been shown to improve clinical quality of care and survival outcomes. Multiple studies demonstrate this isn't just about comfort, it's about living longer. Let me give you some context from research on advanced pancreatic cancer, one of the most challenging diagnoses. A retrospective population-based study examined 5,381 patients diagnosed between 2005 and 2010 in Ontario, Canada. Of these patients, 2,816, that's just over half, received a palliative care consultation. Patients who received palliative care consultation had dramatically better end-of-life care. They were 66% less likely to receive chemotherapy within 14 days of death. They had an 88% reduction in intensive care unit admissions near the end of life. Emergency department visits were reduced by 81% and multiple hospitalizations by 76%. Let me put that in perspective. These aren't just statistics about dying better, they're about living better in the time you have. All patients with newly diagnosed serious illness should have a full assessment of symptom burden, psychological status, and social supports as early as possible. Early referral and initiation of palliative care services improve clinical and quality of care outcomes. Palliative care services improve patients' symptoms, allow patients to avoid hospitalization, and to remain safely cared for at home, lead to better patient and family satisfaction. Palliative care significantly reduces prolonged grief and post-traumatic stress disorder among bereaved family members. If you're worried about someone you love going through this, that last point matters enormously. The data shows palliative care doesn't just help the patient, it helps you, the family member, process what's happening in a healthier way. Depression occurs in approximately 38 to 45% of patients newly diagnosed with advanced cancer. These aren't just numbers, they represent real suffering that can be addressed. Palliative care lowers costs and reduces rates of unnecessary hospitalizations, diagnostic and treatment interventions, and non-beneficial intensive care when patients are near the end of life. Fewer emergency room visits mean less time in chaotic, uncomfortable environments. Fewer ICU admissions mean avoiding invasive procedures that may not align with what you actually want. Better symptom management at home means spending precious time with family instead of in the hospital. The diagnosis of serious illness is unsettling to any patient. Depression has been reported as the presenting symptom in a significant proportion of new cases. A systematic review of 71 studies found that depressive symptoms were present in approximately 38 to 45% of patients newly diagnosed with advanced cancer, while anxiety was observed in approximately 12%. Patients who are depressed experience significant worsening of their quality of life and have more intense pain compared with those who are not depressed. Request a palliative care referral at diagnosis. Don't wait until symptoms become unbearable or treatment options are exhausted. Clinical guidelines recommend full assessment of symptom burden, psychological status, and social supports as early as possible for all patients with serious illness. Specifically, tell your oncologist, "I'd like a palliative care consultation to work alongside my cancer treatment." This is a normal, evidence-based request. Document your goals of care. Palliative care specialists help with communication regarding goals of care and coordinated care across settings. Start thinking about what quality of life means to you, not in abstract terms, but specifically. Do you want to prioritize being alert versus pain-free? Would you prefer to avoid certain interventions? Writing these thoughts down before meeting with the palliative care team makes those conversations more productive. Arrange family meeting. If you're supporting someone through this, request a family meeting with the palliative care team within the first month of diagnosis. The evidence shows palliative care significantly reduces prolonged grief and post-traumatic stress disorder among bereaved family members. Getting everyone on the same page early prevents confusion and conflict later. Comprehensive symptom assessment. Ask, can we schedule a complete assessment of my symptom burden, psychological status, and social supports? This isn't being demanding. It's following evidence-based guidelines that state all patients should have this assessment as early as possible. Coordination between teams. Ask, how will my oncologist and palliative care team communicate about my treatment? Palliative care provides coordinated care across settings and over time. You deserve to know how information flows between specialists. What palliative care actually includes. Ask specifically, what services does your palliative care team provide for pain management, symptom control, and psychosocial support? Understanding the full scope helps you utilize available resources. New or severe symptoms. Uncontrolled pain, severe nausea, significant weight loss, or breathing difficulties require immediate attention. Palliative care specialists have advanced training in managing these symptoms while you continue cancer treatment. Psychological distress. If you or your loved one experiences loss of ambition, loss of interest in previously enjoyed activities, or overwhelming anxiety, these are warning signs requiring professional support. Remember, 38 to 45% of newly diagnosed patients experience depression. Conflicts about treatment decisions. When family members disagree about treatment approaches, or when you're unsure whether to continue aggressive treatment, palliative care teams specialize in facilitating these difficult conversations. Planning for home care. If hospitalization frequency is increasing, early palliative care intervention helps patients avoid hospitalization and remain safely cared for at home. Don't wait until a crisis. Plan proactively. Palliative care from diagnoses works alongside curative treatment to manage symptoms, improve quality of life, and may actually extend survival. Your next step, request a palliative care referral at your next oncology appointment. This information is for education. Always discuss your individual situation with your healthcare provider. I've outlined several reputable resources here, which you may find valuable for further information on this topic. Thank you for watching.